What problems patient face before visiting India?
I think the first problem that the patient will face is which hospital to go to, which doctor to go to. Someone who is 4,000 kilometers away from here doesn't have the ground facts ready. Possibly they have never visited India before. Possibly they have never traveled international before. Because most of the patients that we have are above the age of 50. Sometimes they are traveling internationally for the first time. There is a lot of apprehensions in their heart. How do I travel? What do I do when I go there? And that is where a friend in need is a friend indeed. Get the right medical assistance company who's going to take that fear away. So the first problem is they know a little less about India. They know little less about our doctors. They know little less about our hospitals. These apprehensions need to be taken care of. The second problem, once the patient is ready to travel, is what are the formalities required? Do I need a medical visa invitation? Yes, you do. Do I need a yellow fever vaccination? Yes, you do. Do I need a polio vaccination? Yes, you do. So all these things are things that in some of the countries, yellow fever and polio vaccination may not be compulsory. So many times when the patient are arriving here, they are put in quarantine because they do not have a yellow fever or a polio vaccine with them. And that creates a problem. A good medical assistance company writes in bold and red that please get your yellow fever and polio vaccination done. So all these fears or all these problems are taken care of. Sometimes the patients have limited budget. Sometimes they are not convinced about upon arrival when they have gone to a doctor, when they have gone to the hospital, they are not convinced about that they want to get treated there. In such a case, the medical assistance company should be able to provide them with option B, option C, etc., etc. I think these are the general problems. One big problem that I forgot to mention is when the patients are coming from abroad, many a times we have seen that their diagnosis done locally was not right. But our doctors have been giving a feedback, a plan of treatment basis those diagnostic report. When these patients come here, we find the diagnosis was wrong and the plan of treatment, the line of treatment needs to change. With any change in line of treatment, any change in plan of treatment, the cost obviously do change. And when the cost changes, it creates a financial problem. So a patient should be be ready with some extra finances. Second, they should have the right partner to travel with because they would in that case caution the patient that listen, this diagnostic report is suggesting this, but maybe you should be prepared with some extra money so that in case anything goes wrong, in case something extra is required, you can be taken care of. So that way, these are the major problems. And I think to answer to each of these problems is to have the right medical assistance company assisting you while you are